सीने में दर्द एक आम समस्या है जिसके पीछे कई कारण होते हैं। यह हृदय रोग, पाचन तंत्र की समस्या या मांसपेशियां या हड्डी की चोटों सहित कई स्थितियों का संकेत देता है। यदि आप भी सीने में दर्द का सामना कर रहे हैं, तो यह महत्वपूर्ण है कि आप इसका कारण जानने के लिए डॉक्टर से बात करें। तो इन्हीं सब जानकारियों के लिए चलते हैं डॉक्टर अरुण कुमार के पास और इनसे सब समझते हैं कि जो चेस्ट पेन होता है वो किन कारणों से हो सकता है।
Thank you, Dr. Chandan. As you know, chest pain is the most presenting complaint in the emergency, any medical emergency. In any medical college or tertiary center or primary center, not primary center, better to say secondary or CSC, where the chest pain is the most common presenting complaint these days. And the age group, like the in the middle age group, like the 30, 40, 50, uh, below 20 it is slightly uncommon, but after that, these days you find it is the most cardinal symptoms, and most you can say where the patient become very nervous, or they feel very acute pain, where that requires the help of the clinician, and that time the attendant becomes very afraid, and it is a very, you can say, burden on the government, where they requires the early diagnosis, what is the cause behind that, and they want the treatment therapy. So I would like to say, how you can say कि this is cardiac or non-cardiac, or you can say it is a emergency condition, or it is just due to some gas, or a fullness of abdomen, or any related to the GI symptom or other back causes. So we have should have a highly suspicious to diagnose such cases. And I would tell that these days the what we are generally find in the paper or magazine, or in the articles, or in the social media, that persons just started pain and that collapse, that succumbed. So we should uh, have a clinical idea where we can tell, no, this is a cardiac cause, or this is non-cardiac cause, or other causes, miscellaneous causes. So first, the most common cardiac cause, that is a myocardial infarction or aortic dissection. Uh, that patient becomes very, uh, you can say, serious, and that progresses if early intervention is not done. And apart from that, acute coronary syndrome. Acute coronary syndrome, it is a cascade of phenomena. It is a ischemic cascade, and where you can say the severity and the duration of the myocardial ischemia is directly proportional to the how much damage our cardiac myocyte has been done, the how much insult, what is the time and duration of the insult, that really causes the damage of the cardiac myocyte, and ultimately leading to the as a chest pain, or if you're not going early intervention, patient can succumb in the emergency room also. So now these days a lot of medicine or lot of investigation is going on, but as early possible, we have to investigate. Before that, we have to do the physical examination. In if the patient comes in the emergency room, how we can examine how, that is auscultation, palpation, or nursing staff should have the trained, so that they can appreciate, they can apprehend that this patient is suffering from the cardiogenic causes. So, apart from that, non-cardiogenic cause are also common, which are common causing to the chest pain. And one of most common cause is pulmonary embolism. Pulmonary emboli, either due to fracture or some other reasons, patient having the on hypertensive medicine, if abruptly stop the medicine, then the particles causing the pulmonary emboli, and that really causes the blockage of the uh, and vascular blockage leading to the chest pain, and costochondritis, pleurisy, pericardial effusion, pneumothorax, or any rib fracture, you can say, or herpes zoster, GERD, gastro reflux disease. That all are leading to the chest pain. And that apart from that, these days STEMI, non-STEMI, that is the ST segment elevation or they all are related to the uh, phenomena of the chest pain, and that should be early diagnosed and investigated as much as possible. We should have the clinical idea that if patient has a myocardial infarction or MI, what will be the type of chest pain, what will be the progression, what will be the radiation. Then we can start the management, and we can say, but these days there is this is the common phenomena, and these days general medical practitioner are, they are need to have some sort of practice or some sort of training, because it is not possible that the cardiologist will be available in every PSC or CSC, and if the patient wants or being referred, that takes time, and if, during that golden time, patient got a fatal condition and can have some serious consequences. So to prevent that, these days aspirin or atorvastatin in the loading dosage they are generally given, or sublingual uh, vasodilator. It generally causes the reduction of the cardiac output load of the heart becomes decreased, and patient have some sort of time, and then intervention on the tertiary center can be done. So that is very important. Now coming to the Dr. Chandan, you are doing the community services, and you are very lucky that you are doing in the urban area, and you are doing. So what you feel? Because these days we are thinking that there are a lot of changes in the lifestyle, behavioral changes. So these are all related to the cardiac pain or chest pain. So what is your opinion? What you find? What you want to say about the social things?
बहुत सारे जैसे पीएससी में देखा जाता है कि जैसे आप बताएं कार्डियोलॉजिस्ट के सीएससी और पीएससी में अवेलेबल नहीं होने के कारण, वैसे अवेलेबल तो रेफरल सेंटर में ही रहते हैं, लेकिन उस कंडीशन में जो ट्रेंड जो कुछ जो कार्डियक प्रॉब्लम से जो मरीज सफ़र करते हैं, तो कम से कम उन लोगों को फर्स्टली जो है जो एमबीबीएस लेवल पे, तो उन लोगों को ये पता रहना चाहिए कि किस तरह का मतलब सिम्टम्स मिल रहा हो, तो ताकि सामने बताया कि एट्रोवास्टिन या जो सबलिंगुअल ड्रग दे करके वो टर्शियरी सेंटर पर रेफर किया जा सके, तो जो फर्टिलिटी जो है इसमें कम कम हो सकता है इसके मतलब इसके दौरान। तो ये हम पूछना चाहेंगे कि मतलब कि जानना चाहेंगे कि जो कोई पेशेंट जब आता है तो किस तरह से हम पता करते हैं कि उसको चेस्ट पेन कार्डियक हो रहा है या नन कार्डियक प्रॉब्लम का सिम्टम दे रहा है।
Very nice. As you know, first I already discussed the physical examination is very must. So during the MBBS time, during the internship or house job, this is the NMC guidelines. MCI has very like the basic life support. If the patient or the attendant, they are given the how to handle. They are trained these days, and there is some course that is given by the anesthesia person or uh, cardiologist to the nursing staff or to the caretaker or any person. I think that cardiac massage that should be the primary or first intervention. I think if there is such type of thing, if you suspect, because already I have told that cardiac cause is much more common or much more fatal than non-cardiogenic causes, and that is emergency condition, acute emergency condition, acute coronary syndrome. So we have to system where the MBBS doctor or the person working as a PSC that should be have a proper training, and that is the one part. Apart from that, for the society, I will try to say that some risk factors are there which are generally responsible for the genesis or progression of the chest pain that is related to the cardiogenic causes. So हिस्ट्री बहुत ही इम्पोर्टेंट है. सिम्टम जो है उससे हम पता कर सकते हैं कि ये हो सकता है या ये स्ट्रेसर है या नहीं. जैसे पेशेंट विद हाइपरलिपिडीमिया, secondary hypertrophy causing the chest pain in the form of the deposition of the plaques or fibrin in the coronary artery. Apart from the person having the diabetes mellitus or person with obesity or a person taking the cigarette, that really acts on the enzyme and it inhibits the enzyme and leads to the chest pain. So this history is very much important if you suspect the cardiogenic causes or a patient in that age group comes. So ऐसा मैं इसलिए बोल रहा हूँ ताकि जो पेशेंट के अटेंडेंट है वो सोच सकें, और अगर ऐसा है स्टिमुलस तो उस स्टिमुलस को, उस कॉज को हटाने की वो कोशिश कर सकें. So apart from that, coronary artery disease, as you tell, coronary artery disease is the basic thing where we have to much more attentive. And coronary artery disease is what it means. It actually perfuses the our cardiac myocyte or that muscle, cardiac musculature. So if there is any change in the diameter or any blockage, that common sense is that should be leading to the chest pain or cardiac abnormality in the form of the perfusion or murmur, systolic murmur, systolic dysfunction or diastolic dysfunction. So first we have to diagnose, that is a surface electrocardiogram, just it is popularly known as ECG. ECG, by showing the ECG we can tell that uh, when it occurs. If the patient comes as early possible, then we can find some positive things in that graph, or if it becomes late, then we can do the stress electrocardiogram. After stress, there will be some finding. Uh, but one thing I try to tell is that because our communication system is not so fast that we can do ECG at time when it is required. So in that cases, we should have some biomarker which is really helpful, and we know where the cardiac symptoms abated. In that time, only these biomarkers like the CKMB, creatine kinase, and or troponin T, IC. These are the most helpful biomarkers, which after the MI, if person has MI 6 hours back or 7 hours back or one day back, this that biomarkers which is really available in the serum or the through blood, we can take and we can uh, think that the patient has some cardiac insult some hours back or some days back, and then we can by other intervention we can go through, like the cardiac perfusion or nuclear MPI, myocyte perfusion imaging. It is the most diagnostic evaluation and really helpful. So I think myocardial also the MPI. Before that, we can go for the echocardiography. Echocardiography will also give some idea about the valve. It give the general idea, but it's much that is patient is suffering for aortic regurgitation or myocardial regurgitation or incompetency. So such ideas, such general idea we can get. That primary idea can we get from that echocardiography, and that is much more helpful. So before after that, stress myocardial perfusion imaging. That is a part of the nuclear medicine where we use the CT, SPECT CT or PET CT by use of the radioactive tracer like the system maybe scan, or technetium 99. That is a radio tracer where, or we can say like rubidium. Rubidium is also helpful. Rubidium 82 and thallium 201 is also a radio tracer which is generally tagged, and that gives us the image and acquisition of that image after tracking on the gantry. Image is done, uh, that is gated, and I think that is much more informative apart from uh, CT angiography or ECG or electrocardiography, or you can say echocardiogram. So that is the advanced technique where we can uh, assess the function of the heart, and we can give the probable idea what is the cause of the insult or what will be the next step, and prognosis of the patient. For prognostication, it is also helpful. After that, Dr. Chandan, because it is emergency condition in the medical colleges, you have already seen that condition become very haphazard and is the most common cause where the attendant or the doctors or nursing staff become very confused or they become very stressful condition, and in I don't want to say, but in sometime in the medical colleges some uh, bad thing happens if it is misdiagnosed. And if you give other medication which is not proper or some IV fluid, that secondarily causes the overload, and a patient becomes can this become more fatal. So I think we should take it very seriously and at as early possible, with help of the proper diagnosis what I have told, because in the medical colleges still it is not possible for the say myocardial perfusion imaging. It is still it is a academic view, not it is practically seen. I can say in the government colleges still a lack of. So ECG is a basic thing there. So cardiologist or cardio physician should have some primary idea, and they can imagine and as early. But what I already told, some that you also mentioned, our system should have like that, so that our nursing staff or intern or some medical graduates or other people, even the attendant, they so that they can early intervene if they have some idea of the we can say cardiac massage or stress condition. So what do you think, what you like to say in this regard about the mandatory?
जैसा कि समय समय पे आप इस वीडियो के माध्यम से, चैनल के माध्यम से सब दर्शकों को आप अवेयर हमेशा कराते रहते हैं, और करीब आपने 10,000 लोगों का निःशुल्क ब्लड प्रेशर, ब्लड शुगर, और ये प्रिवेंटरी के तौर पर ईसीजी वगैरह भी बहुत सारे लोगों का किया। तो इसमें ये एक जो ये कम्युनिटी लेवल पे जो आप किए, इसमें काफ़ी लोगों को हेल्प भी मिला, और बहुत सारा कम्युनिटी लेवल पे आपको इस तरह का भी लोग मिलते हैं कि वो लोग इग्नोर करते हैं। तो इसमें आप क्या मैसेज देना चाहेंगे जो लोग इग्नोर करते हैं, जो कि कहते हैं नहीं हम फिट हैं, किसी तरह का कोई प्रॉब्लम नहीं है? किसी कभी कभी तो ऐसा मिलता है कि सभी हर एक चीज़ सही रहने पर भी जब उसका चेकअप किया जाता है तो वो नॉर्मल लेवल से काफ़ी हाई रहता है। इस कंडीशन में आप उन लोगों को क्या मैसेज देंगे?
Uh, Dr. Chandan, I think in nutshell, you want to say how I can aware the general person which generally neglect this condition. So first I will tell life is very important, and there is a phenomena in our body where to some extent, to some stage, either first or second stage, we can reverse the pathology or the disease. But after that, it becomes very impossible. It becomes very debilitating for the patient and for the attendant, where it becomes impossible, and prognosis becomes very sophisticated and prognosis becomes very difficult, poor. So, uh, so I will tell such type of thing that should that shows our negligence, and even the I will tell, कह सकते हैं कि जहाँ एक गोली से काम हो जाए, एक टैबलेट से काम हो जाए, वहाँ हजारों टैबलेट भी काम नहीं करता है एक स्टेज के बाद। तो फर्स्ट तो we can, but because our literacy rate is very low, so I don't think ये कहना भी उचित होगा कि ऐसा उनकी सोच को हम गलत नहीं ठहरा सकते। तो एक बहुत बड़ा एक क्वेश्चन है, बट इस सोशल मीडिया के माध्यम से हम शायद बात कर सकते हैं, लोग अवेयर कर सकते हैं कि नहीं, किसी भी बीमारी को, नट की चेस्ट पेन और कार्डियक चेस्ट पेन, किसी भी बीमारी को इजी ना लिया जाए। कुछ बीमारियां ऐसी होती है जो अभी तो खत्म हो जाती है कुछ देर के लिए, बट ट्रीटमेंट के अभाव में, प्रॉपर ट्रीटमेंट के अभाव में उनका मैनिफेस्टेशन आने वाले टाइम में दूसरे तरह का और भयावह होता है, डेंजरस होता है, और ये चीज़ इरिवर्सिबल भी हो जाता है, और चाह कर भी हम कुछ नहीं कर पाते। तो ये जो थिंकिंग है, जो नेग्लिजेंसी है, दैट शुड बी अवॉइडेड, एंड we should consult senior person or the expert person, और अगर इस तरह का सोशल मीडिया है उसके माध्यम से जुड़कर हम कुछ भला कर सकते हैं, अपने थिंकिंग को चेंज किया जा सकता है, किसी बीमारियों के प्रति अपना नज़रिया बदलना चाहिए। एक ही बात हुई। चलिए, अगर ऐसा हो भी जाता है तो मैंने जो बताया कि इस तरह से कुछ साइन सिम्टम्स हैं जिससे हम बहुत सारे चेस्ट पेन वो हार्ट से रिलेटेड है, कार्डियक रिलेटेड है, तो कैसे पता कर सकते हैं, जो हमने डिस्कस किया। नटसेल में कभी भी चेस्ट पेन को एनाल्जेसिक से दबाने की कोशिश नहीं कर जाए। कई बार लोगों को देखा गया है कि कुछ नशा में की हालत में भी लोग उस चीज़ को, क्योंकि नशे से भी कुछ एनाल्जेसिक का काम करता है वो, और वो नेगलेक्ट करते हैं, और कभी कभी वो हार्ट अटैक का काम कर जाता है और उनको पता भी नहीं चलता है। सो दिस इज़ द, और ये भी एक टाइप का नेग्लिजेंसी है कि नहीं यार कोई बात नहीं है, ये तो सिंपल गैस हो सकता है, और ये, और वो एस्पिरिन और रैनिटिडीन, पेंटोप्राजोल का यूज करके, और अपनी जो ओरिजिनल पैथोलॉजी है, जो कार्डियक पैथोलॉजी है, और वो प्रोग्रेस करता जाता है और नासूर बन जाता है। और अगर कुछ परसेंटेज लोग जो कि रियल में दे वांट टू इंटरवेन कि क्या करना चाहिए, तो एटलीस्ट डिस्प्री एस्प्रिन जो 150 मिलीग्राम का 75 टू 150 मिलीग्राम के डोज में स्टार्ट कर सकते हैं। एटोवास्टैटिन, ये सब विथ अगर कुछ भी ईसीजी, इफ देयर इज एबनॉर्मलिटी इन ईसीजी, दे कैन स्टार्ट विदाउट एनी हिंड्रेंस और विदाउट एनी ऑब्स्टेकल, बिना टाइम बर्बाद किए हुए ये कर सकते हैं। और उसके बाद वो आजकल कम्युनिकेशन तो रोड का और सड़क का हो चुका है, एक आध 2 घंटे में पूरे इंडिया में आप किसी कार्डियोलॉजिस्ट के पास अच्छे हॉस्पिटल में जा सकते हैं, मुझे लगता है। उसके बाद आप इस चीज़ को लाइफ सेविंग ड्रग्स के तौर पर ये आप कर सकते हैं, उसके बाद सजेशन ले सकते हैं। एनीथिंग एल्स, इफ यू वांट टू कमेंट देन यू टेल व्हाट यू थिंक अबाउट दैट।
डाइट को भी मेंटेन करना है।
हाँ, डाइट डाइट इज डाइट लाइफ स्टाइल मॉडिफिकेशन भी है, दिनचर्या, ये तो बहुत जरूरी है। क्योंकि आजकल जो जितने भी बड़े बड़े सेलिब्रिटी जो है का हमने देखा, या और भी जो यंग पर्सन जो जैसा सोच भी नहीं सकते थे हम लोग, वो उनके फूड हैबिट की वजह से उनको 20-30 के बीच में ही अटैक आ जा रहा है, एंजाइना के तौर पर, स्टेबल एंजाइना, अनस्टेबल एंजाइना, स्टेमिना स्टेबल। सो ये तो ज़रूरी है उनके लाइफ स्टाइल में, और फूड हैबिट को प्रॉपर करना, योगा का हेल्प लेना, और दिनचर्या को तरीके से करना। दैट इज़ द नॉट फॉर द कार्डियक पेन और चेस्ट पेन, फॉर एनी टाइप ऑफ डिसऑर्डर, किसी भी बीमारी के लिए ये प्राइमरी चीज़ है। एंड प्रिवेंशन इज बेटर देन क्योर। ओके, थैंक यू।